Hey everyone, welcome to today's YMyHealth podcast. I'm your co-host Melissa Schenkman for today, and we have a very special YMyHealth contributor back with us, Mikaya Franklin. She is a cancer survivor of medulloblastoma, which is a type of brain tumor that forms in the cerebellum that can affect the part of your brain that controls balance and coordination and movement. Actually, if you tuned into episode 36, she shared her full journey with us during diagnosis and treatment, a little bit after survivorship. But one of the things, as we both know, that does not get talked about enough is that survivorship piece and what is going on in the years following completing your treatment for cancer as a young person. And so we're so happy to have Mikaya here with us to share with us about her journey and what's been going on in your life these days. And how many years now, let's see, are you into survivorship?
I think this is 3.
3, that's what I thought. Yeah, 3 years into survivorship now. So
Mhm.
welcome,
Thank
Mikaya.
you.
Awesome. Well, excited to have you here. Since you originally shared your story with us, as I was mentioning back in episode 36, what are some of the changes that have kind of become a part of your new normal day to day? And we talk a lot about the new normal. But what has become like the normal or the new normal over the
Right.
past, yeah, exactly, over the past 2 years, would you say? Walk us
Um,
through that.
well, first of all, since the last time we talked, I graduated.
Yeah, I was gonna
So
start with that. Yeah, super exciting. Congratulations.
yes, I got my master's in biology,
Awesome.
online, of course.
Awesome.
Um, so that is a big accomplishment for me.
Huge.
So I would say
Huge.
that's part of my new normal
Yeah.
that I'm a master's student. Mhm, mhm.
Awesome. Awesome.
But in terms of survivorship, I still get MRIs every 3 months.
Okay.
So that's a little frustrating just
Yeah.
because 'cause I'm tired of getting MRIs. They give me anxiety being in the machine for almost 2 hours.
Yeah.
Gotta be still, you know how MRIs go.
Yeah.
So it's fine until, it's getting closer to 2 hours, and I'm like, "All right, that's enough. Get me out."
Yeah.
So that's a part of my new normal. Hopefully, it goes to every 6 months soon, but we'll see. Um, Also a part of my new normal is, like, this double consciousness because I really haven't changed. Like, I'm still doing everything that I wanna do, that I have been doing, going places, doing things. But then I'm also thinking, okay, well, if I go to this place, where's the closest restroom? What if I have to, run, which I can't run, but what if I have to run to the restroom or like, let
Uh,
me, are there going to be stairs? I can't walk up the stairs like I used to. Or how is the ground going to be? Is it going to be grassy? Is it going to be this? Am I going to have to carry something a long distance? Like, I'm always thinking, I might not show it,
yeah.
but it's always a thought. So
That
that's
makes
frustrating.
sense. Yeah.
Um,
That and the MRIs, the regular MRIs. I mean, those machines, they are loud. They are so loud.
And I've been being treated at children's,
Mhm.
and so it's kinda cute because they have movies playing the whole time, it's really cute, but
Oh,
now they're about to transition me to the adult hospital, and they don't have movies, so I don't know how I'm gonna make it through, but it's
aw.
okay. It's okay.
They have
Um,
music. A lot of times they have music and you get to choose, like, different things to listen to. I know it's not the same, but you get to choose
yeah.
different things, but still, and have you been still at the children's hospital just because that's where you initially 'cause you were kind of in that, like, in between age group
Yeah.
and where
They
it could get good.
they called me last week to tell me that they're about to transition me to the adult hospital, and
Yeah.
so I have, like, my final appointment with children's next month, I think.
Okay.
Um So I'm sad. I'm sad. Like, I know I'm 26, but y'all can keep me forever, you know?
Hey, understandably so. There's a lot to be said for pediatric care compared to adult healthcare. Yeah. Yeah, which we're gonna
Definitely.
talk a little bit about later on in this episode too, for
Okay.
sure. Yeah. 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 Yeah, so I appreciate that. So the far as obviously the master's in biology is super exciting, but the MRIs kind of that, and then the
Yeah.
other considerations, kind of as if you're doing all the normal stuff. Because far as I know, you were saying you're doing everything you want to do. So obviously, um, with having finished school, I know you've had some opportunities to travel. a little bit and spending time
Yes.
with friends and driving and all that.
I'm still doing everything. I'm still making like the double consciousness, but I'm also making minor major adjustments to my life. Like I used to be right-handed. Now I'm probably a left-hand person. I write with my left hand. I do most of my activities with my left hand. I carry things with my left hand. I brush my teeth with my left hand. It's a lot
Wow,
of
that's a big
things.
change. Yeah.
Yeah, I can use my right hand, but it just takes so long. And
Mhm.
sometimes it's not accurate. Like if I'm trying to brush my teeth and then I use my right hand and then like the brush ends up on my cheek and I'm like, you know what? This could all be simpler if I just use my left hand. So that's what I do most of the time. Use
Yeah.
my left hand. So yeah, I'm part of the left hand community. Hmm. Yes.
Well, that's no, those are some big changes to have in your life. Absolutely. Kind of medically speaking, I know you were doing like regular physical therapy, regular occupational therapy. Kind of, are there any updates on those? And are you able to kind of do a little less in certain areas? I know that was a big hope of yours.
Yes. So I am still going to physical therapy. I was also doing occupational therapy, both of them at the Shepherd Center. It
Mhm.
was about an 8-week intensive kind of thing. Um, and while I was there, they put me in contact with a guy at Hanger Clinic who makes like orthotics and prosthetics and stuff like that. And so he made me like a knee, ankle, foot, whole leg
Oh, wow.
prosthetic. I call her Bionica because like the Bionic Woman, I had to
I
name her. I
love
don't know.
it.
Um, so it helps with the hyperextension that I now have in my knee because, my whole right side was affected. So some of my muscles like atrophied and like got weak. And one of the byproducts of that was my knee now hyperextends. And so to like protect my ligaments and stuff, I'm supposed to wear Bionica like when I'm walking long distances or like running errands or hiking. I don't know when I would ever be hiking, but I'm supposed to wear her for that. Um, Now I've also gotten another smaller brace, but it does protects my knee against the hyperextension too, and I wear that one more often because it's just more convenient to wear. But yeah, so that happened when I was at Shepherd. I only had a couple like 8 weeks worth of appointments. So then I transitioned to First Step Physical Therapy here in Fayetteville. And I've been there for about 2 weeks now.
Okay.
And he is a PT. The guy I'm working with, he's a PT,
Yeah.
but he also does like OT type of stuff. So yeah, so my therapy now is more like both combined. Um,
That's nice. That's
yeah, so
really nice.
I'm still doing that. Um, I think the struggle for me is knowing what I need to do and
Mm.
doing it. It's two totally completely different things because I'm at the point now where like physical therapy will help me.
Yeah.
I, you know, need physical therapy, but I also need to do stuff myself. Go to the gym, workouts. I have so many home workouts. I could be a physical therapist myself. I know all the exercises.
I bet.
Um, but exercising at home now, and I need to go to the gym. I need to strengthen everything,
Yeah.
like my hip, my knee, my arm, because everything on my right side is weak. So at a certain point, I need to go to the
Yeah.
gym and strengthen. Um, so it's just difficult knowing that and then actually finding the motivation to do it.
Yeah. Yeah.
That's the problem. That's the
There
problem.
I can understand. There are a lot of people who can relate to that in general without needing to do it for the specific reason that you're needing to do this. People, it's just so hard to be motivated to go on your own for some people and also to make the time. I mean, you're a busy
Yeah.
person too, and so making that time, but I think, you know, that's so important, obviously, for you to do to get those, muscles and everything back up to speed, and it'll take time, but I can understand, and so many people as they're listening also understand trying to find that motivation to get into the gym,
Yes.
making the time, as well.
What I just came up with was
Yeah.
2 G's, guilt and grace,
Yeah.
because you have so much guilt like I said, knowing what you need to do and not doing it, and you're like so guilty. Oh, I could be so much farther along, or I could do this and I could do that if I were to just do it. But also giving yourself grace, realizing that, I have come a long way. There are things that I could not do that I'm now doing. Like just last week, I think mentioned before that I couldn't wear like shoes without the ankle strap. Like I needed to have
Mm.
it contained in order for it to stay on my foot. As of like 2 weeks ago, I'm wearing shoes like slides
Oh,
without an ankle
wow.
strap, and they're staying on my foot.
Oh, that's
And so
extremely that's a
doing
big
stuff, thank
yeah,
you, doing
yeah.
stuff like that and not going to the gym consistently or working out consistently, it's like, okay, you have to give yourself some grace too because you are still making progress. You are dealing with a lot of stuff. Like,
Yeah.
I feel like it's a balance between
Oh,
the 2 G's.
absolutely.
Yeah.
No, that's a great way to put it. No, absolutely. You do have to give yourself grace because it's a lot to take on, doing all that. And I know you're also in the process of trying, professionally to go to professional school beyond, right? Beyond that
Yeah.
master's, which is like a hard enough thing to get in
And I'm
itself.
still going.
Oh my gosh. So to balance all of that is a lot,
Yeah.
to do, absolutely. And then far as anything else, well, I guess you were saying it's combined now, as far as the OT part, is there anything else that you're having to do, like, on a weekly basis as part of your regular schedule?
Um, no, no, not really. It's just now incorporating the at-home exercises, going to the gym, um, piece with what I'm already doing in physical therapy.
Gotcha. And are there any side effects? I know when we last talked, there were a lot of different things, and you've obviously progressed tremendously. I mean, the fact that you're wearing those slides alone, not just sho- says a great deal. And I know you wanted to be able to jump, and I know you hope to obviously, right. We were talking about the stairs before and running, you know, in the future too.
Yeah.
But, are there any side effects at this point from treatment that you were told, like, early on would get better with time and, that you've continued to experience?
So, for example, my eyes, I still
Mhm.
have the double vision when I look down. I think I mentioned that last
Yeah.
time.
Yeah.
And they said that's not gonna go away. Like they could do another surgery to try to fix it, but
Mhm.
then they risk messing up something else and not have double vision, So we're just gonna leave that alone. So I think the double vision looking down is here to stay.
Okay. Sorry to hear that.
Everything else, jumping, walking up the stairs, running, dancing, skating, all of
Mm.
that. Um, it's kind of up in the air. It's like it could get better, but it
Okay.
could not get better. So it really just kind of leaves me in a sense of suspension. Like I don't
Sure.
know. So I just work with the hopes of it is going to get better. I believe that it's going to get better, but I really don't know.
Yeah. No, understandably so. Understandably so. And again, you've really helped to paint a picture of what the new normal looks like. And as you were mentioning before, you're still doing like all the things pretty much you used to do. One of those big things is you're very social um person. And so, for you kind of in terms of social life, how has this impacted friendships in the last 2 years of, being a survivor and being this in this survivorship phase?
Um, I can answer that from 2 different aspects, kind of. For me, I feel like my friendships haven't changed. So, for example, my friend asked me, she was getting married in June. She asked me to be a bridesmaid for her. She got married in Houston, so I traveled down there. I was a bridesmaid for her in her wedding.
Wonderful.
So I'm not letting this stop me
Yeah.
from doing
Yeah.
what I want to do. I want to be social. I want to be a part of other people's lives, and so I just do it. But from a, like, friends to me perspective,
Mhm.
I think it's more like, I don't have cancer written on my forehead, so it's not a thing that people
Yeah.
bring up all the time, like, "Oh, how's physical therapy going?" or "How, was your MRI?" unless I just say it or I post something about it, then somebody will ask, but it's not
Mhm.
something people see all the time, so it's not really on the forefront of people's minds, if that makes sense.
Yeah. No,
So they might say, "Oh, your walking looks good," like, randomly, but they're not talking
Well,
about, like, the little incremental pieces, if
yeah.
that makes sense. So, I don't know.
Well,
I
the
don't
I
know.
mean, yeah, but no, in those 2 ways, that's very interesting, and we talk a lot about, kind of what we call invisible illness in millennials and the kind of the different, um, ways that it impacts people, but you wouldn't know because 'cause you're going about doing everything, right? And so people don't know maybe the other things like you talked about earlier that are on your mind, when it comes to going out to do something that wouldn't be on their mind, right? Or different things
Exactly.
you're doing. So I think to your point, that's very interesting, those 2 particular ways, and that brings me to really the question of, what are some of those things you started to talk a little bit about thinking about, like, uneven ground, before and what that looks like, but what are some of the things that you've had to think about, just like when you were going to the wedding, when you've accepted social invitations from great friends, they all sound like great friends, to go you're gonna go have a good time. What are some of the things that you've had to think about and, like, think differently about that you didn't have to in the past?
Well, that's my first thought. Every time anybody asks me to do anything, I'm always thinking about what I'm gonna encounter, what's gonna be there, what obstacles am I gonna have to face, like the walking situation. Um,
Yeah.
and the problem is, it's not really a problem, but I'm so busy and people always ask me to do things. So just like since May, I was in the wedding. I've been on a cruise. I walked the stage at graduation. I Oh, guys, that's something else. My brother graduated. I went to the Boots and Dukes thing in Atlanta, at Atlanta Motor Speedway. A lot of walking there. So I just do things. Like I
Yeah.
just say yes first and then think about everything else later. Um, but I'm supposed to be going to California to visit my friends in September. Of course, I say yes on friend, no doubt. My friend, he wants to take me to a football game, and I'm like, "Oh god, the walking, I'm gonna have to walk 30 minutes to the stadium. Am I gonna get tired? How's my endurance? What about my knee?
Yeah,
Am I gonna wear my brace? Am I not gonna wear my brace? Am I gonna bring Bionica? Am I not gonna bring Bionica? Like, are there seats there? If I have Bionica on, how am I gonna use the restroom very quickly if I have to go to the restroom in a public restroom? Like,
yeah,
there are 3,000 million trillion thoughts going through my head that I do think about, but I don't let it stop me from doing what I wanna do.
which is absolutely wonderful, and you've always had such an incredible attitude throughout everything, um, such a positive person, and you shouldn't let it stop you,
Yeah.
I think that's such an important message to tell people too, um but since you do have to think about these things, have they impacted your mental health in any way, that has made you, wanna seek support for that? Because I know that was not something that was really something as much of concern last time we talked.
Yeah, so when I was going through treatment and all the stuff,
Yeah.
everybody was saying, "Oh, you should talk to somebody, you should," not because they saw something wrong per se, but it's like,
Mhm.
"You're going through a lot, so you need to probably talk
Yeah.
to somebody," and I was like, "No, I don't really need that." Um But it was soon after I ended cancer and I was still, like, experiencing things, like, I call it cancer PTSD. My therapist told me I didn't have PTSD. I think I did have PTSD. Um, but my mom was a major advocate, and of course, she's here to support me, but she was like, "I think it would be beneficial for you to talk to somebody else, like, who knows what you're going through, who can actually help you." Um and so I did go talk to somebody and it was fun. I mean, for me, it was fun just to talk about it. I didn't really have any issues per se, but it is a lot going through this and like trying to navigate it and just to be able to get it off my chest was beneficial. But mentally, more recent now because I still am doing stuff and like going out into public spaces with people who are normal, quote unquote,
Yeah.
and I'm not normal, quote unquote. Um, and so it's like very frustrating to see that, like, oh, are people looking at me crazy? Like, for example, I went to a concert
Yeah.
a couple months ago, and when you're in a row with people, you have to like squeeze past them, like shimmy past.
Yeah.
I be struggling. I be struggling a lot, and so sometimes I have to hold on to people's hands, like, "How can I hold your arm to get through?" You know what I'm saying? So it's just like having that as people's first thing that they see about you is kind of, it decreases your self-confidence a little bit.
It's
Or
understandable.
even walking and even if you're not a judgmental person, that's the
Yeah.
first thing you see about somebody. If they walk up to you or you just see them walking past and I've had people ask me like, "Oh, why are you walking like that?" or "What's going on with your knee?" or like just stuff like that.
Oh, wow.
And so just hearing comments like that and knowing people see that, it's like, hmm, that's a
Yeah.
little upsetting. Um, so yeah, it does affect you mentally, but I don't let it get to me, you know?
Yeah. Yeah.
'Cause I
Yeah.
can't control that, and
Exactly.
it's just what it is.
Exactly. Well, I'll tell you, you're in very good company because there have been so many people we've talked to within our YMyHealth community who are cancer survivors, and they have told us how much going and seeking mental health support in their survivorship phase at different times has made a huge difference.
Yeah.
Really, we've heard that from a lot of people, so I think that's great to that you did that and that you're sharing it with other people to let them know, for sure. And also just about these things that we wouldn't always think about so that we know and it's kind of on our radar what different things people are going through
Right.
as well as they go about day to day being an active young person, living their lives. Kind of for you, I know the healthcare system and talking about the healthcare system, you have such a unique perspective when it comes to the healthcare system because you were working in an ER before before you were diagnosed with cancer. You had always had planned to be in the healthcare field originally with med school, to go. So you're very familiar. And of course now with your master's in biology. So I'm very curious. I know other people will be too. As a cancer survivor, how has kind of the way you navigate the healthcare system changed as you move through it, as opposed to how you maybe used to move through it and viewed it in the past?
So initially, I will say, let's start off by saying the healthcare system is good. I wouldn't be here without it. Well, let's start there. Okay, going
Yes.
back, I put 100% of my faith and everything in the healthcare system. They're gonna figure this out. They got this. They know what's best. La 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 la. Okay. Now, I feel a little differently about that, just, like, looking back at it because there is so many things that I knew that I was not told like, I found out that I was not told about initially, things that I had to figure out for myself, and I
Mm,
just feel like it shouldn't be like that. Like, in this case, I'm the patient, and you guys are supposed to be, the experts in this. Why do I feel like the expert? I'm not understanding. So the biggest thing would be the physical therapy
mhm.
piece. So for my insurance, I have Blue Cross Blue Shield, and I only get 40 sessions a year, right? First of all, that makes me mad because
Of course.
who are you to tell me that I only need 40 sessions a year?
Right.
Like, what happens if I still need therapy after the 40 sessions?
Yeah.
And so then I've heard from a lot of the physical therapists, okay, you just pay out of pocket. Just
Well,
pay out of pocket. Do you know how much a session is?
yeah. Yeah.
And then it's not like you're going once every month, like you're going 2 to 3 times a week,
Yeah. Yeah.
you know? Um, and so just that. So now, fast forward, I have two insurances. Um,
Oh, yeah.
Blue Cross Blue Shield, United Healthcare. So when the Blue Cross Blue Shield appointments run out, I
Yeah.
switch over to United Healthcare with a different provider that takes United Healthcare. I've just had to play the game. Like, okay, y'all
Of
don't
course.
want to give me what I need. We're just gonna figure this out. We're gonna figure
Yeah.
this out. So I guess like self-advocacy, kind
Mhm.
of just being able to like, okay, I know what y'all are doing, but I know what I need, and so
Yeah.
we're just gonna figure out what I need to do to get what I need. Yeah.
Yeah. No, that makes sense. And also just in terms of I'm curious when you go to and I don't know if you've done this anytime, let's say in the past 12 months, but you go to visit a new doctor or a new health I mean, obviously with the PT is new, but somebody who you haven't been to before, has it kinda changed, what's on kind of the top of your mind as you enter an appointment or, um, even if it's not specific to your
What's going on?
expertise. Yeah, I'm really curious if it's kinda changed the way you perceive people, like, when they walk in the room, you're like, different than previously.
I need to know. Um, yes and no, but more
Okay.
yes. Because, for example, I went to a gastroenterologist
Mm,
um a couple months ago because I've been having stomach issues.
mm,
Still like nauseous and vomiting, which I told my oncologist about and told them I think this is related to my chemotherapy. They're like, hey, it's been 6 or 7 months since chemo. I'm pretty sure this has no correlation to the
mhm.
chemo. To me, that doesn't really make sense because I didn't have stomach problems before chemo. And chemo is known to mess up your gut bacteria, all of that. So there might be some correlation. I don't know. I'm not a doctor. Okay.
Right.
So, anyways, I went to the gastroenterologist with this information already because I'm like,
Right.
I don't know. I don't know if I trust this all the way.
Sure.
Um, but they came back and said that I had gastroenteritis.
Oh, really?
Yeah, and then had to take some medicine and all the stuff. And I'm like, there is a large chance that this was because of my chemo.
Right.
And why I was the person to figure this out and not my oncologist or, the people who are specialized to figure this stuff out didn't figure it out.
Yeah.
I don't know.
Yeah.
So yes, it kind of has changed my perspective just
Sure.
because you would think that the healthcare system, they know everything and they're going to inform you. It's really the other way around. Sometimes. I'm not saying all the time,
Right.
but sometimes.
No, absolutely. Very good point. And also that and really it just shows how important being your own advocate is. And you've
Yep.
grown to be your own advocate even more than you were before. And that just goes to show and we all understand about the health insurance too. That's another delightful topic in healthcare.
Right.
So I very much appreciate you bringing up. What do you think people are missing about young cancer survivorship, that there needs to be more tools for and support for both at an individual level, like amongst peer support, what people know, but also like at a larger public health level that you would like to see or that you've thought about in the past couple of years.
This could be a lengthy topic. Okay, but we're just gonna
Of
keep it
course.
we're gonna keep it short. Um, I feel like for the individual aspect, it's pretty good. There's a lot of support groups out there for survivors, and I think the resources are out there if you want them.
Yeah.
For me personally, I was already interested in like science and medicine, so I wish that I was like more informed on the science behind everything, like without me having to ask.
Sure.
Even sometimes I would ask and they
Of
didn't know.
course.
So it's like, I don't know, that was just kind of frustrating because it's like, okay, I'm doing the research. You could simply do the research too and come back to me. It's like I'm coming up with stuff that they should be telling me about. So I didn't really like that too much. But it also is a flip side because granted, if I wasn't interested in science or medicine or anything, there are things that I wouldn't know about that the doctor didn't tell me about. So I would have just been lost. Like a a side effect of a medulloblastoma can be a side effect is posterior fossa syndrome.
Mm.
Um, it really affects your speech and like your emotions and all this other stuff, which I found out on my own because I was having emotional issues. And,
Wow.
so then I reach out to my oncologist and I'm like, hey, is this what this is? And, I had to go through the whole thing with her. I'm like, why didn't you bring that to me?
Yeah.
You know? Um, so that's on an individual level, but I think on like a healthcare
Yeah,
larger
healthcare system.
scale,
Yeah.
the coordination of care,
Mm.
not good. It's not good. I don't know what health system most people use, but Epic was like my thing. And so the doctors will say, "Oh, we put it in the chart, or we put it in your my chart, so other doctors could see it." But just because they can see it doesn't mean they look at it and incorporate it into their care for you. So it's just
Yeah.
like Now, what's the point? Was Yeah, the coordination of care piece could be much better. Also, it was kind of like a lot of the stuff that happened to me, or the things that they gave me to fix whatever problem, was felt kind of like haphazard, kind of reactionary. Like, oh, you're
Mm.
dealing with this. Oh, let's do this. There was a lot of stuff I feel like the healthcare system missed. Like
Mm.
big stuff, which I'm going to talk about in the book that I'm releasing.
Wow,
But
can't
for
yeah,
example, for example, um, my fertility stuff.
yeah,
Not being told in enough time, having to kind of talk to the people myself to figure out, oh, hey, you're going to need to get your eggs removed before chemo because chemo could ruin them. Y'all didn't think it was important to tell me that.
yeah,
And, I could give them an excuse saying, well, I was being treated at a children's hospital, and that's not usually the top topics that they discuss, but they knew
yeah,
my age when I was getting treated there.
yeah,
So
exactly.
or it was like after I had been getting chemo for a couple months, and a nurse just randomly said, like, not even like in the midst of a conversation, are you sexually active? Because, if you're sexually active, you should, abstain, because we don't want to like give the chemo medicine to your partner. Did nobody want to tell me that 4 months ago when I started chemotherapy?
Wow, wow,
So stuff like that. It's just like,
yeah,
no, if we want to talk about this. And then it just kind of goes back to explicitly stating what you think we should know. If you have a medulloblastoma, here are some things that it might not, but here are some things: posterior fossa syndrome. You could have this. You could have gastroenteritis because your stomach could get messed up from the chemo. Like, there's a lot
yeah.
of things that they just didn't say that could have been beneficial.
No, that's really, really helpful to hear, and I know that a lot of other people, that's really gonna resonate with them, but really
Yeah.
appreciate you sharing that with us tremendously, and what's next for Mikaya Franklin? Tell us. I know you just mentioned a book.
Yes. So hopefully that'll be done soon. I won't put any dates on it,
Yeah,
but I just want to share my story, and hopefully let people know, like, you're not alone, and some things to maybe look out for that I didn't know going into this whole situation, because when you get diagnosed with something like this, who does? Um, so that is really my inspiration for writing this book.
awesome.
But other than that, I am taking classes right now. I'm back in school, retaking anatomy and physiology and medical terminology, so I can apply to PA school, physician assistant school, next year. Um, so doing that, I am tutoring little first graders. So
Aw,
cute. Yes, because they need help a little bit. And
yeah,
so I'm helping them with that. But physically, hopefully, I'm back skating, dancing, running, jumping, going up and down stairs, with no issue. I'm very excited about what the future holds for that.
awesome. No, very, very exciting. Very excited for you to be getting closer and closer to that path that you've always dreamed of in healthcare, and also really excited about the book, and we'll definitely have you join us again on the podcast when that comes out. But and also taking the time to help uh the little kids is so nice too. I think that's awesome that you're getting so many steps closer to where you've always dreamed of being, in the healthcare profession, helping younger kids, and the book and everything is all very, very exciting. So I really appreciate you taking the time out of your busy schedule to give us updates on things and really shed light on survivorship and the survivorship life, because that's so important. So many people are looking to hear people's stories
Yeah,
on that, and always, yeah, and really it makes such a big difference because that's something that people don't talk about enough.
right.
uh and how can people connect with you if they'd like to reach out? What would be the best way?
So my Instagram is my name, Mikaya dot Renee, Renay, my middle name. And then my TikTok is at Mikaya Franklin. Um, I love TikTok. People reach out to me all the time because I posted a video the last time of like the symptoms of a
Yeah.
brain tumor. And so people from all over have reached out to me saying their family member got diagnosed or like they got diagnosed and or if they should go to the doctor, they've been experiencing symptoms. And of course, I'm not a healthcare provider, but it feels good to be able to like provide that reassurance or like answer their questions about my story about what is going on with them, as much as I can. Um, and then my Facebook is just Mikaya Franklin. So you guys can follow me on anything. I love to talk to people, reach out, I'll respond.
Wonderful, wonderful. Well, thank you so much for coming on the podcast.
Of course. Thank you for having me.